White blood cells help protect your body against infection and disease. However, white blood cells called lymphocytes can undergo changes that make them grow out of control and cause a form of cancer known as lymphoma. Lymphoma is really two different cancers, called Hodgkin lymphoma and non-Hodgkin lymphoma. These diseases share some similarities, but they're also different in important ways. Both types of lymphoma begin in the lymph nodes, which are bean-shaped structures that make and store lymphocytes. Lymphocytes travel throughout the body in a network of tube-like vessels to fight infection. Both Hodgkin lymphoma and non-Hodgkin lymphoma begin when a malignant tumor forms in a lymph node. That cancer can spread to other lymph nodes or organs. In Hodgkin lymphoma, cancer tends to spread to nearby lymph nodes first. In non-Hodgkin lymphoma, the spread of cancer is less predictable. In 1666, an Italian doctor named Marcello Malpighi was the first to describe a disease that sounds like what we now call lymphoma. But it was a British physician, Thomas Hodgkin, whose name became associated with these blood cancers. In 1832, Hodgkin reported treating a series of patients who had died of a mysterious condition that caused their lymph nodes to become enlarged. That disease became known as Hodgkin lymphoma. Doctors eventually realized that there were cancers similar to Hodgkin lymphoma that affected other types of lymphocytes and behaved differently. These cancers became known as non-Hodgkin lymphomas. There are 4 major subtypes of Hodgkin lymphoma and more than 60 subtypes of non-Hodgkin lymphoma. Each subtype is unique and requires its own treatment plan. Non-Hodgkin lymphoma is much more common than Hodgkin lymphoma. In fact, there will be nearly 10 times more cases of non-Hodgkin lymphoma diagnosed in the United States this year. These 2 types of blood cancer tend to affect different age groups. Hodgkin lymphoma primarily occurs in people under 40. Younger people can develop non-Hodgkin lymphoma, but more than half of cases occur in people over 65. Both forms of lymphoma are more common in men than in women. Your risk for certain types of lymphoma is also higher if you have been infected with the Epstein-Barr virus. Lymphoma seems to run in families, so your risk is increased if a close blood relative had this cancer. The same is true if your immune system has been weakened by another disease, or you take medications that lower your immunity. In early stages, Hodgkin lymphoma and non-Hodgkin lymphoma may not cause symptoms. However, patients may develop swollen lymph nodes in the neck, underarm, or groin. Other symptoms include fever and night sweats. Some people with lymphoma lose weight without trying. They may report feeling itchy, especially after bathing or consuming alcohol. Or they may simply feel tired and lack energy. The treatment a doctor recommends for lymphoma will depend on which form and subtype you have, whether the cancer has spread, your age, and other factors. Treatment options for people with lymphoma include chemotherapy and radiation. Patients with lymphoma that's hard to treat or that comes back after treatment may be candidates for a stem cell transplant, in which healthy blood-forming cells are infused into the body. However, there are new treatment options available for patients with lymphoma. One is called immunotherapy, which makes the body's natural defense system stronger and better able to shrink tumors. Another new option for lymphoma is a group of drugs known as targeted therapies. These medicines take aim at specific gene mutations or proteins that cause cancer cells to grow and spread. Targeted therapy and immunotherapy have improved the treatment of lymphoma and the lives of patients. However, there's another option for many people with lymphoma. Enrolling in a clinical trial can give you access to new therapies months and even years before they're available to other patients. These advanced treatments can be life-changing, and some may even offer a cure. There are currently over 1,700 clinical trials of lymphoma treatments underway or getting started around the world. Give yourself the gift of hope by learning about all of your lymphoma treatment options.